This is the most frequently performed abortion and is used typically from 5 to 13 weeks of pregnancy. After administering anesthesia, the abortionist uses a speculum like this. This is placed inside the vagina and opened using this screw on the side, allowing the abortionist to see the cervix, the entrance to the uterus. The cervix acts as a gate that stays closed for the duration of pregnancy, protecting the baby until it is ready for birth. The abortionist uses a series of metal rods called dilators, like these, which increase in thickness, and inserts them into the cervix to dilate it, gaining access to the inside of the uterus where the baby resides. A 14 French suction catheter. It's clear plastic, about 9 inches long, and it has a hole through the center. It is inserted through the cervix into the uterus. The suction machine is then turned on. One of the risks of a suction D&C is incomplete abortion. Essentially, pieces of the baby or placenta left behind. This can lead to infection or bleeding. In an attempt to prevent this, the abortionist uses a curette to scrape a lining of the uterus. The curette is basically a long-handled curved blade. Once the uterus is empty, the speculum is removed and the abortion is complete. The risks of suction D&C include perforation or laceration of the uterus or cervix, potentially damaging intestine, bladder, and nearby blood vessels, hemorrhage, infection, and in rare instances, even death. Future pregnancies are also at a greater risk for loss or premature delivery due to abortion-related trauma and injury to the cervix. As I mentioned at the beginning, I'm Dr. Anthony Levatino, and in the early part of my career as an OBGYN, I performed over 1,200 abortions.